Hey everyone, welcome back. I'm Dr. Jennifer, and if you're over 60 or if you're caring for a parent or a loved one who is, I need you to stop scrolling for the next few minutes because what I'm about to share could genuinely save a life. Every single day, I see patients who have no idea that the little pill bottle sitting on their kitchen counter, the one they trust completely, the one their pharmacist handed them with a smile, might be quietly working against their heart and their brain. We're talking about medications that are completely legal, completely common, and sitting in millions of medicine cabinets across the country right now. And the scary part? Most people never connect the dots until something goes wrong. So today, I'm breaking down 5 categories of medications that, after age 60, can significantly raise your risk of heart attack and stroke. I want to be crystal clear before we start. I am not telling you to stop taking your medication today. Please do not throw away your pills after watching this video. What I am telling you is to get informed, write down your questions, and have a real conversation with your doctor or pharmacist about whether these risks apply to you. Knowledge is how you protect yourself, not panic. Now let's get into it. Number 1 on the list is something almost everyone has used at some point. Common over-the-counter pain relievers, specifically NSAIDs like ibuprofen and naproxen. Think about this for a second. Your knee hurts, your back is acting up, you take an ibuprofen, and you feel better in 30 minutes. It feels harmless, almost like candy for pain. But here's the catch. These medications work by blocking certain enzymes in your body, and those same enzymes play a protective role in your cardiovascular system. As we age, our blood vessels are already less flexible, our blood is more prone to clotting, and our kidneys don't filter as efficiently. NSAIDs can raise blood pressure, cause your body to retain fluid, and increase clotting risk, all of which together create a perfect storm for a heart attack or stroke. Research has shown that even short-term use of certain NSAIDs can raise cardiovascular risk within the first week of taking them, especially at higher doses. I had a patient, let's call him Mr. Thomas, who took ibuprofen almost daily for chronic arthritis pain for years without ever mentioning it during his checkups, because to him, it wasn't a real medication, it was just a pain pill. That casual mindset is exactly what makes this category so dangerous. If you're over 60 and reaching for these regularly, that conversation with your doctor is non-negotiable. Number 2, and this one surprises almost everyone, is decongestants, the kind found in many cold and flu medications and sinus pills. We've all been there. Stuffy nose, can't breathe. You grab something off the pharmacy shelf labeled for sinus relief, and within the hour you feel like a new person. The active ingredients in many of these products work by constricting blood vessels to reduce swelling in your nasal passages. The problem is, your blood vessels don't know the difference between the ones in your nose and the ones feeding your heart and brain. That same constriction effect happens throughout your entire circulatory system, which means your blood pressure can spike, sometimes dramatically, within minutes of taking these. For a younger, healthy person, this might just feel like a slight jitteriness. But for someone over 60, especially someone with existing high blood pressure, narrowed arteries, or a history of cardiovascular issues, that sudden spike can be the spark that triggers a stroke or cardiac event. I always tell my patients, think of your arteries after 60 like an old garden hose that's lost some of its flexibility. Now imagine someone suddenly cranking up the water pressure through that same hose. That's essentially what a decongestant can do to vessels that are already under strain. Number 3 is a category that often flies completely under the radar: certain hormone therapy medications, particularly hormone replacement therapy used for menopause symptoms, and in some cases, testosterone therapy in older men. I understand why these medications are appealing. They can dramatically improve quality of life, reduce hot flashes, improve energy, improve mood, and many women and men feel genuinely transformed when they start them. But here's what doesn't get talked about enough. Several major studies have shown that starting hormone therapy later in life, particularly more than 10 years after menopause, is associated with a meaningfully higher risk of stroke and cardiovascular events, partly due to effects on clotting factors and blood vessel function. Similarly, testosterone therapy in older men has been linked in some research to increased cardiovascular events, especially in those who already have underlying heart disease. This doesn't mean hormone therapy is automatically dangerous for everyone. Timing matters enormously, and so does your personal health history. But it absolutely means this is not a medication to start or continue without ongoing cardiovascular monitoring, especially once you cross that 60-year threshold. Number four is one that affects a huge number of older adults. Certain antipsychotic medications, often prescribed for anxiety, severe sleep issues, agitation, or in dementia care. I want to be sensitive here because I know families dealing with a loved one's dementia or severe behavioral symptoms are often desperate for anything that brings relief and calm to an impossible situation. But there is now substantial evidence, strong enough that regulatory agencies have issued formal warnings that certain antipsychotic medications used in elderly patients, particularly those with dementia, carry a significantly increased risk of stroke and even sudden cardiac death. These medications can affect the heart's electrical rhythm, leading to dangerous irregular heartbeats, and they can also increase clotting risk. The tragic irony is that these drugs are sometimes used specifically because a patient is agitated or combative, when in reality, that very prescription might be quietly raising their risk of the very kind of medical emergency families are trying to prevent. If you have a parent or loved one on one of these medications, this is a conversation to have directly and urgently with their physician, weighing the real benefits against the real risks, because this is not a category to manage passively. Number five, and this one catches people completely off guard because it's marketed as a quick fix for an extremely common problem. Certain migraine medications, specifically triptans, when used by older adults or by anyone with underlying cardiovascular risk factors, migraines can be brutal, truly debilitating, and triptans have been a genuine game changer for millions of sufferers because they work fast and they work well. But the mechanism behind why they work is the exact same concern we saw with decongestants: vessel constriction. Triptans narrow blood vessels in the brain to relieve migraine pain, but that constriction effect isn't perfectly localized. In someone with narrowed or hardened arteries, which becomes increasingly common after 60, that same constriction can reduce blood flow enough to trigger a cardiovascular event. This is precisely why these medications carry specific warnings against use in patients with a history of heart disease, stroke, or significant cardiovascular risk factors. The challenge is that many people have been taking the same migraine medication for decades, since their 30s or 40s, and nobody ever revisits that prescription as their risk profile changes with age. A medication that was perfectly safe for you at 35 is not automatically still safe for you at 65, and that single fact applies to almost everything we've covered today. Now, here is the bigger picture I really want you to walk away with. None of these five categories are inherently evil medications that should be banned or feared. Pain relief, decongestion, hormone balance, mental health management, and migraine relief are all legitimate medical needs that deserve treatment. The real issue is that your body at 60, 70, or 80 processes medications completely differently than it did at 30. Your kidneys filter slower. Your liver metabolizes differently. Your blood vessels have less elasticity. Your blood is more prone to clotting. This means medications that were once perfectly safe for you can quietly become risk factors as your body changes, even though the dosage on the bottle never changed at all. This is exactly why something called a medication review with your doctor or pharmacist becomes so critical after 60, ideally at least once a year, where every single thing you're taking, including over-the-counter products, supplements, and anything you consider too minor to mention, gets laid out on the table and reassessed against your current health status. So here's what I want you to actually do after watching this video. First, make a complete list of every medication, supplement, and over-the-counter product you take regularly, even the ones that seem harmless like allergy pills or sleep aids. Second, schedule a dedicated appointment with your doctor specifically to review cardiovascular risk in the context of your current medications. Don't just bring it up as an afterthought during a 5-minute checkup. Third, if you're caring for an elderly parent, do this same review for them because they may not think to question medications they've been on for years. And finally, share this video with someone in your life who needs to hear it because the most dangerous thing in healthcare isn't a difficult diagnosis. It's the silent risk that nobody ever talks about until it's too late. I want to leave you with this thought. Your heart and your brain have carried you through decades of life, through every challenge, every joy, every hard season you've pushed through. They deserve a little extra attention and protection as the years go on, and that protection starts with awareness, not fear. You don't need to feel anxious about your medicine cabinet. You need to feel informed and empowered to ask the right questions. That's the entire goal of this channel, to give you real, practical, doctor level insight so you can walk into your next appointment not as a passive patient, but as an active partner in your own health. If this video helped you see something in a new light, do me a favor, hit that subscribe button because I'm going to keep bringing you the kind of information that genuinely matters, the things that often get glossed over in a rushed 10-minute appointment. Drop a comment letting me know which of these 5 surprised you the most. I read every single one. Take care of that incredible heart of yours, ask the hard questions, and I'll see you in the next video.